Hey, future respiratory therapist, got a story I want to share with you today. And the purpose of this story is not to cast judgment or ridicule or to cast stones or blame on anybody. It's just simply to make this story aware to you so that you know that as humans, we can make mistakes. And a mistake like this could potentially happen to you if you're not aware of it and you don't learn from mistakes that you're made aware of. So, the story goes like this. Roughly a year ago, in December of 2017, there was a patient that was being taken care of at Vanderbilt University Medical Center. The patient had ordered a full body scan to be done down in the radiology department. The patient was claustrophobic and expressed these claustrophobic fears to the care team. And the nurse, doing the right thing, went to the physician and said, hey, the patient is nervous and doesn't want to do the scan because they're claustrophobic. So the physician ordered Versed. Now, Versed is an anti-anxiety medicine that will reduce the fears commonly associated with medical procedures. And so the nurse goes to pull the Versed from the medication dispensing device. The nurse types in VE, the first two letters of the medication Versed, and the medication device populates drugs that start with VE. And so routinely the nurse grabs the first one that pops up, and that drug happened to be vecuronium instead of Versed. Now, vecuronium is a paralyzing agent that leads to skeletal muscle paralysis and paralysis of the diaphragm. So the patient is now completely awake and alert, can feel pain, can feel discomfort, can feel anxiety and fear, but cannot move or breathe to express these concerns. So the vecuronium is administered to the patient. The patient goes in for the full body scan. The care team comes back into the room to take the patient out of the scanner, to move them back to their room, and they find the patient is pulseless. They rush back to the ICU. Life support measures are implemented, and then days later, those life support measures are withdrawn, and the patient ultimately dies due to this medication error. So I want to talk to you about this because this is something that you do not want your name linked to. You don't want your facility linked to something like this. And to understand it, you need to understand, first of all, what an error like this is termed. And it brings us to this term, Sentinel event. Now, Sentinel event is defined by Joint Commission, who is the organization that gives accreditation to hospitals and to healthcare facilities to say you can keep your doors open and you can keep taking care of patients. Now, they define Sentinel event as any event or any care, procedure, practice, any event in a patient's hospital stay that leads to death, bodily injury, or emotional distress that is not naturally linked to the patient's course of care that brought them into the hospital. Okay, so clearly you can understand that this patient died because of medication error. There was no need for them to get vecuronium, and that classifies as a Sentinel event. Now, Sentinel events must be avoided. If there was any one way that you could say, do this, and Sentinel events will always be avoided, if that existed, somebody would be very, very wealthy. Okay, but that's not the case. Sentinel events are a complex topic that happen due to lots of different reasons. Now, on the board here, I have what I believe to be the three common reasons that lead to Sentinel events. And I think most Sentinel events can be linked back to one of these three things. So let's talk about them. The first one is knowledge. You've got to know what you're doing at the bedside. If you don't know what you're doing, then how in the hell can you do it safely? How can you provide safe care if you don't know why you're doing it, how to do it, and what your expectations are from the therapy that you're doing? Okay, so you've got to have your knowledge base. Now, your school will set you up with a strong foundation as it goes as in regards to knowledge base. So you'll graduate with the foundation of the knowledge that you need to go out there and provide safe care. But I promise you this, you won't know everything, and you will be uncertain in certain circumstances. And this leads me to this common failure that I see in new grads and respiratory therapy students. Human nature says, I got a job, I want to do my job well. I don't want my employer to think that I don't know what I'm doing, and that think that I'm going to let my employer down if I have to ask for help. And that is wrong. Employer after employer after employer, every one of them will say this: I hire you to be a part of our team. I hire you to go out and provide safe care. And I trust that as a respiratory therapist on this team, if you don't know how to do something, you will seek out help. You will contact the department educator, an experienced therapist, your team lead, your supervisor. You will go to the policy and procedure manual. You will do something to educate yourself so that you can stand at the bedside and provide safe care to our patients. Okay, so don't ever be afraid to seek out help if you ever find yourself in a situation where you don't know why, how, or what you're doing. Okay. The second thing on the board here we see is work conditions. Now, work conditions is a big topic. If I asked everybody to everybody watching this video, list one work condition that could lead to a potential Sentinel event, the list would go on and on and on and on and on forever. So a couple of big examples of this would be you don't have the equipment that you need to do your job in a safe or correct manner. So lack of equipment. Maybe it's lack of staffing. Maybe you're going to find yourself in a facility to where you're asked to go out there and do 100 or 75 or 80 treatments in a 12-hour shift because you don't have the staff to have smaller workloads. So this workload is going to cause you to do things in an unsafe manner if you allow it. Okay, if you allow it. One of my biggest pet peeves is what we call concurrent therapy. And this is when you go give a breathing treatment, you walk into the patient's room, you start them on their medication or their therapy, and before that treatment is over, you go to the next one and you start them, and then you go to the next one and you start them, and you go to the next one and you start them. And by the time you're done, you have 3, 4, 5, 8 treatments going, all at the same time, but you don't have your eyes on any of those patients. And that can lead to adverse reactions that you're not at the bedside to identify and to pick up on when they happen. Okay? So you got to understand that work conditions can put barriers in place that make Sentinel events possible. Now, the last thing is complacency. Complacency is a direct result of doing something over and over and over and over and over to the point that you become very comfortable doing it. And as you become more comfortable, you decide to, or maybe you don't decide, it's either consciously or subconsciously, you start cutting corners and skipping important steps. Sometimes this leads to the overriding of safe measures that are in place. So a prime example of this would be not checking your patient's armbands before administering a medication, or pulling medications out of the medication dispensing device without actually verifying what meds you pulled, without reading the label of a medication before you give it. Complacency would also, a good example would be, I don't need to check their vital, I don't need to do their vital signs before I give this albuterol treatment because they're fine. Or not listening to breath sounds, or not doing a post assessment because they're fine. All of those things are examples of complacency. And as you become more comfortable, you're going to have to battle complacency in your field and in your job as a respiratory therapist. Now, you can see how each of these three things can obviously cause to unsafe patient care and ultimately lead to a Sentinel event. Now, any one of these can lead to that. Now, put yourself in a situation to where you're not sure about what exactly you're doing. Your work conditions are have you set up for failure from the get-go, and you find yourself complacent. So I can do my job with my eyes closed. And when you close your eyes, that's when something happens. Okay? So understanding these three things will help you understand how to prevent a Sentinel event from happening. I want to leave you with this. Complacency, I believe, is the most important on this list. Because if you become complacent, you'll stop learning. If you become complacent, you'll stop battling back against the work conditions. You'll stop focusing and slow down and say, I'm in this work condition, but I can fix it because I have the knowledge and I have the passion inside of me to approach every single patient as a new patient. And when you understand that you knock on that door before entering that room, that you're taking care of someone's loved one, their mother, their father, their grandfather, grandmother, son, daughter, granddaughter, best friend. If you approach every patient like that with passion and trust your knowledge base and seek out help when you need it and slow down, then your risks of experiencing a Sentinel event, I promise you, go way, way down. The last thing I want to leave you with is this. If I ask you, why are you in a respiratory therapy program right now? Your answer should be to help people. To help patients that are in the hospital setting or in the outpatient setting get better, to make them feel better, to help them get over their disease or learn how to cope with their disease better, to leave the patient in a better condition than what I found them in. If your answer is, well, I was in IT and it crumbled and now here I am, I just needed something because I need a stable job. People are always going to be sick, healthcare stable, so I got into healthcare. Or if you say, well, I just wanted to make a decent living, so I decided to get into healthcare because you're always going to need healthcare providers and they pay good. And so I want to make a good living. If your answer is anything other than taking care of human beings, taking care of sick patients, making people feel better, then get out. Your patients don't need you. Your healthcare facility that you're probably going to go work at, they don't want you. And quite frankly, the profession of respiratory therapy, we don't need you either. So focus on your patients. Keep the passion that's got you in this field with you throughout your career. And use that to be your fuel to prevent complacency from setting in. Always seeking out the knowledge that you need to take care of your patients. And to always be smart enough to recognize work conditions when they're going to set you up for failure. Hey guys, I hope everybody, first of all, is having a great day. I'd love to keep this conversation going. Put your comments down in the discussion below. Share it with each other. Remember, we're not here to cast stones or talk about the specific of the events. It's a tragic story. I feel bad for the healthcare provider, for the nurse that this happened to. I feel bad for the facility. Vanderbilt University Medical Center, their Medicare status is now in question because of this event. And most importantly, I feel bad for the patient and the patient's family. It's a terrible, tragic event. Don't let it happen to you. Stay focused. Keep the passion. Hope you have a great day. Go be great.